Thank you. Sorry about that. I couldn't unmute myself. But good afternoon, everybody. Delighted to be here closing the summit today. I hope you found the agenda and content useful. I really have. It's been a great session. I've been asked to speak about the current challenges in the NHS, so I thought it would be useful to cover the main priorities for our work stream at NHS England. Next slide, please. So this slide is very busy, but it basically covers the role that the workforce transformation and supply team at NHS England are committed to, and that is to ensure that we have the NHS workforce and talent pipelines that we need. This slide shows how the priorities for the talent for care team are interlinked. First, we have development, which is our role in ensuring that apprenticeship standards and other vocational educational qualifications are fit for purpose. We continue to work closely with DfE, ESFA and IFA and NHS employers to make sure that that is the case. The next priority is implementation, and this work continually evolves as we support with national and regional procurements and employer engagement and scoping. In addition, we develop resources and toolkits to share best practice. Next chunk is quality, and this has many strands, and it's really, really important to our work. We run quality networks for our NHS employer providers, for universities that are delivering level 6 and level 7 programs, and they're supported by former Ofsted inspectors. We also develop resources and case studies and partner with the regulators and professional bodies in the sector, and that is a huge amount of regulation that we need to encounter. With demand for apprenticeships in the NHS growing year on year, it is essential that we have a wide range of providers available to deliver from level 2 up to level 7. And poor Ofsted outcomes recently have had a really detrimental impact on our national and regional provision. Sustainability is the next chunk, and that is very important as our aim is for technical and vocational education to be seen as business as usual and implemented in all areas of the workforce. The NHS long-term workforce plan is due to be published, and apprenticeships are mentioned in every chapter relating to every profession in the NHS, which is a huge change from the last plan, which was published in 2019. The last priority is cross-cutting, which incorporates wider societal issues, which are such as social mobility and widening participation, and the care certificate. So Claire from Dynamic will be very familiar from this, but it is what is an agreed set of standards that define the knowledge, skills and behaviours expected of specific job roles in the health and social care sectors. The care certificate is made up of the 15 minimum standards that should be covered if you are new to care and should form part of a robust induction programme. The care certificate was designed to meet the requirements set out in the Cavendish Review. We offer a Care Certificate Leads national network, which has a powerful presence in terms of bringing like-minded people together to consult, share and network. Another part of cross-cutting is ensuring we have an entry-level talent pipeline via work experience, volunteering and school engagement, and other projects such as the Prince's Trust and Project Choice, which offer supported internships for young people with SEND, which obviously Claire's just covered. It's always challenging working in the NHS due to years of underfunding, but there are some particular risks we have identified to our work streams. Next slide, please. First is IF8, sorry to say, but their role obviously is in updating apprenticeship standards and endpoint assessment and the development of new standards. At the moment, feedback is they are woefully under-resourced, and the knock-on effect is huge delays in updating standards and assessment plans in all sectors. T-levels, after the major issues that we had with the curriculum exams for the health and science in the initial cohorts, there is a need to restore confidence. Many young people switch to BTECs, and NHS employers, many have lost their faith, which will further impact on our talent pipelines. I put HTQs because as part of the higher technical education reforms, IF8 have created approved HTQs as an alternative to apprenticeships or degrees. Surely we need to simplify the technical education landscape, not further complicate things. Who are they aimed at? As NHS employers, we're not really sure we can see the benefits, and why would we encourage learners to take out loans when we can fund qualifications, similar qualifications, via the apprenticeship levy? In the NHS, it's vitally important that our workforce represents the communities that we serve, and many employers believe their recruitment processes are inclusive, but in reality, how inclusive are they? Multiple interview stages for entry-level roles are prohibitive and will deter applicants if, for example, they're neurodiverse or they're from underserved communities or care experience and would need financial assistance to attend. We are currently working on an EDI toolkit and engagement webinars to support NHS employers, especially in light of the increase in the care leavers bursary from 1st of August this year. Much has been misquoted about the NHS long-term plan in recent weeks. I'm sure you've all seen it. And in particular, inaccurate and misleading articles around degree apprenticeships, insinuating that apprentices do not attend university. These articles have had a very wide reach in the mainstream media, and it's evident so much more needs to be done to bust these myths and raise the parity of esteem for apprenticeships. In the NHS, international recruitment has always been challenging in terms of the costs involved for the employers and the return on investment, and even more so post-Brexit. We therefore need to ensure that we can mitigate this and at least in part meet our critical workforce needs with homegrown talent instead. In terms of strategy, there is still uncertainty post the HEE and NHS Inc merger, which took place on 1st of April. So we need to ensure that we have the capacity to continue our work, importantly, nationally and regionally. An emerging issue is the entry-level talent pipeline into the 350 roles available in the NHS and fierce competition from other sectors. In some areas, vacancies are at all-time high due to Amazon and Audi, for example, offering very competitive salaries and even free transport into work. Maths and English attainment continues to be a barrier into work or career progression in the NHS and many other sectors. There's been much talk recently by Robert Halfon, the Minister for Education, around the ladder of opportunity, but government and policymakers seem to think that the ladder starts at level 3 and ignore the missing rung of the ladder, which is much needed for level 1 and level 2 starting points. Hundreds of thousands of young people leave school every year without grade 4 or C in these crucial subjects. And in the NHS, existing staff often have issues evidencing their qualifications if gained overseas or without having certificates. Level 2 apprenticeships offer people for all ages the opportunity to study maths and English functional skills, which will allow them to progress their career pathways. You'll be well aware that staff pay and morale continues to be a crisis situation in the NHS, with many professions choosing to strike to lobby government into a fair pay offer. The cost of living crisis has only highlighted the comparatively low pay for many of these critical roles, and attraction and retention continues to be impacted. In addition, apprenticeship completions are at risk due to strike actions by university and college staff. Some apprentices are already reporting issues and delays due to staff strikes and lack of capacity for exams and marking, and therefore delays to their endpoint assessments. So in very difficult times, we must continue to rely on the passion and dedication of all NHS staff to ensure we can weather the storms and that our team can continue to support employers across the NHS to create the workforce of the future. That's it from me. Thank you very much for listening.
Thanks, Lucy. We have got one question, which is that the new apprentice doctor roles appear to have come at the perfect time, but how do you tackle the stigma that still exists around apprenticeships?
Really good question, and that's kind of what I was referring to in my talk. The articles that we saw about the medical doctor apprenticeship were so damaging. Basically, one, because they were factually inaccurate. You know, the headline, school leavers will become doctors and bypass medical school, is just utterly ridiculous. And it is really disappointing for all the people that have been working so hard since the apprenticeship reforms to kind of overcome this. So I think all we can do is just kind of continue to fight the good fight. We put out retractions. We asked the Telegraph and the Guardian to retract their inaccurate articles, but that doesn't make the headlines, does it? You know, the damaging article had over 2 million views and the retraction had like less than 200. So I just think we need to continue to raise the parity of esteem, and I think it starts at school level, because I'm going through this with my daughter at the moment. She is very clever academically, predicted 8s and 9s, has mentioned that she would like to do an apprenticeship potentially next at a level 4 or level 5, and her head teacher sucked in her breath and was like, but you're far too clever for that. And I think that is part of the fundamental issue, is that people still think that apprenticeships are for the trades, but actually now you can become a doctor, which is just amazing, and we just need to kind of continue to fly the flag.